I grew up in Kentucky, and I got into medicine because I thought the field was very interesting. I had an injury as a teenager that kind of opened the door to medicine for me, and I got interested in it from there. In your medical school residency, you go through different areas, and surgery was always interesting to me, and so that's just the area that I kind of chose to go into. So quality care is extremely important in that all the physicians in the committees, we strive to try to set quality goals. We try to come together and ensure that we have processes in place that ensure quality for patients. The quality committee is a committee made up entirely of physicians with appointed physician leadership by the physician chief of staff. When we set out to build this hospital, we wanted it to be, modern, progressive, state-of-the-art. Along the development design of the hospital, they had physician input to try to make it more efficient. We had teams that we put together to develop each area of the hospital, people who work in those areas in order to try to make suggestions and work with the architects to develop a hospital that flows and functions best for the physicians, patients, and everyone all together. The people were friendly, the staff is friendly, and the community is friendly. And it's just a good place to live and work. This hospital is financially very stable. It is expanding and growing as we are trying to make our footprint more of a regional footprint rather than a local footprint. And so as such, the physicians that come into this area tend to find themselves busy. So we have just about every specialty that you can have here. We have committees that range from peer review to quality to surgical committees, to block management committees, to IT committees. That's an open door. We have a good physician community, very progressive and intelligent physician community that work together. Well, I think that everything in the surgical services and cardiac services are trending toward less invasive techniques. And that's the most exciting thing in any type of specialty oriented, is that we continue to improve technology in order to make things less invasive for patients so that their risk and recovery are better. I think that there's a lot of opportunity, both primary care and specialty oriented, in the region. There's a tremendous need for physicians in this area, and I think that the opportunity to grow a practice here and stay long term is very, very good.